So we get lots of wild birds. It's not tame. This is a wild corella. It was caught in a net at one of the schools. Kind of knows we're helping it because it's not going absolutely crazy. And this is a bird that we're going to release. We're looking for a really good outcome. If you come in closer, you can see the net's actually caught. This is called the patagium membrane. It's one of the main flight and anatomical things in a bird that help with flight. So what we do, besides cleaning and treating the wound, we massage it, and we try and massage the wound so we don't lose elasticity of the patagium membrane, because I'll need this bird to fly again because it's going to be released. It was netting to protect, I think it was fruit trees to protect from birds, and it got caught and entangled. This is the good side. The bad side is really bad. You can just see again, but at least this is not on the patagium membrane. And the elbow is not broken. This is over the elbow equivalent. So there would be the humerus, and the radius ulna comes off here. So what we've been treating it with is we've been using something called F10. He's on an antibiotic. We put this bird on an antibiotic called clav. And I also use something called silverzine or flamazine, which I've been rubbing on it every day. And it's a really nice antibacterial cream. Remember that you've got to be really careful when you use cream in birds, because it can make the feathers oily. So we obviously put a tiny amount. You've got to look at, and obviously with something like this, it gets antibiotics and pain relief. So the antibiotics, as we said, are clav or amoxiclav. We use really high doses in birds. It gets 100 milligrams per kilogram. Which is really high, and we also use pain relief called meloxicam. Interesting, not like, as opposed to humans, the antibiotic gets absorbed very quickly and distributed very quickly and out the system quickly. So it's really pulse doses, but it still seems to work well. Today's day 3. It's going off to a carer in the next. It's going off to a carer today. So we send some silverzine, we send some antibiotics. We might even give them some probiotics just 1 or 2 days before release. But I want you to know that vets spend a lot of time doing pro bono work on little birds like this, that you can actually see is, I don't want to pat or tame it, but you can actually see it knows we're helping it. Because we're an avian clinic and avian vets, we're holding it very gently. It's not stressed by the way I'm handling it. I'm not holding it in a hard way. And we take donations. We've got a wildlife donation box, because we have cases like this almost every day. So next time you see a wild bird, just remember there are a lot of vets helping save and release them. You might see this little guy out in the wild soon, hopefully. Say hello to everyone. And you can see it's not terrified to be here, even though it's never been exposed to people.